Today, we're going to dig into the secret ingredient that takes a good nurse and makes them a great one. And here's a hint. It's not something you'll find on a medical chart. It's all about the powerful connection between psychology and nursing. So let's just start with this one question. We all have an idea of what makes a nurse good, right? They're skilled, they're on top of things, they're efficient. But what's that extra little spark, that thing that makes a nurse truly great? What turns a competent professional into a genuine, compassionate healer? Well, the answer isn't buried in some dense medical textbook. It actually lies in having a deep, practical understanding of the human mind. It's really about seeing the person, not just the patient. It's seeing the fear behind the fever. To really get to the heart of this, here is the roadmap for our journey. We're going to start with a blueprint of the mind itself. Then we'll uncover what a psychologist's mission really is. After that, we'll map out the territory of nursing psychology, and finally, open up the practical, everyday bedside toolkit that nurses use. So let's jump in. All right, first up, the blueprint of the mind. Before we can talk about its role in nursing, we kind of need to be on the same page about what psychology actually is. At its very core, the definition is pretty clear and scientific. Psychology is the study of two main things: our behavior, the stuff we do, and our mental processes, which is all that stuff going on inside our heads. Let's break that down a little. So behavior is anything you can actually see, an action, a response. Think about someone talking or walking or crying. Now, mental processes, that's the internal world. That's the stuff we can't see, like memories or emotions or how we learn. And psychology is what connects those two worlds. A really simple way to remember all this is the think, feel, do framework. Cognitive is our thinking, our memories, our perceptions. Affective is our feeling, all our emotions and moods. And conative is our doing. It's the drive that turns all those thoughts and feelings into actual actions and habits. Pretty much every human experience is some mix of those three. Okay, so now that we've got a handle on what psychology is, let's look at what it actually tries to do. This brings us to its mission, which can be broken down into 4 key goals. These goals make a lot more sense when you see them in a real-world scenario. So picture a nurse with a young patient who's crying. The first goal is to describe, okay, the child is crying. Simple enough. The second is to explain why. The crying is because of a fear of the needle. The third goal is to predict. The child will probably cry again next time they need an injection. And then here's the most important step for a nurse: to modify. They offer comfort, maybe a distraction to help reduce that fear. Describe, explain, predict, and modify. That's the mission. With those goals in mind, let's zoom out for a second. In this next section, we're going to map the whole territory of psychology, just so we can see exactly where nursing fits into this much bigger picture. There's this common misconception that psychology is only for studying mental illness, but its principles are absolutely everywhere, in our families, in schools, at work, and especially in hospitals and clinics. It's really just a tool for understanding people, no matter the context. And the field is vast. It's got all these branches like clinical, developmental, and social psychology, but the one we're zeroing in on today is right here: health and nursing psychology. This is where the science of the mind really meets the art of healing. So what is it exactly? Well, it's the direct application of all these psychological principles right there in a healthcare setting. We're talking about real, tangible skills, things like patient counseling, helping people manage the incredible stress of being sick, and mastering the art of communication between a patient and their caregiver. And this brings us right to the heart of our whole explainer, the bedside toolkit. How do nurses actually take these concepts and use them in their day-to-day practice? Yeah, this isn't just theory. It's a whole set of practical tools. A nurse uses psychology to understand what a patient is feeling, to build trust. It helps them communicate tough news, motivate someone through a grueling treatment, and support the entire family. And so importantly, it also helps the nurses themselves manage their own stress and avoid burning out. Let's look at how this really works. For a scared little kid, a nurse might use play therapy to explain what's about to happen, which gives the child a sense of control and dials down their fear. For a psychiatric patient, they'll use something called therapeutic communication to build a sense of safety and rapport, creating an environment where healing can actually start. And for a cancer patient who's just gotten a difficult diagnosis, they provide emotional counseling. The tool is always tailored to the person. So, let's wrap all this up with our final takeaway. We've talked about the what and the how. Now let's really focus on the why. Because great nursing is about so much more than just a procedure. When you boil it all down, this is what it's all about. Psychology is the bridge. It's what connects the technical, clinical act, the procedure itself, to the deeply personal, human experience of being cared for. It's what makes sure the person gets treated, not just the illness. It's the skill that gives nurses this incredible power to truly understand their patients, to help calm their fears, and maybe most importantly, to build a relationship that is in and of itself a powerful part of the healing process. So I'll just leave you with this question to think about. The next time you see a nurse in action, what are you going to see differently? Will you maybe notice those small acts of psychological care, the reassuring words, the patient explanation, that brief moment of connection that really do make all the difference? Thanks for joining us.